Michelle Kemp. I'm one of the obstetric consultants here at Addenbrooke's, and I have a real interest and passion in supporting pregnant women who are struggling with their mental health in pregnancy. With me today I've got Eleanor.
Hi, my name's Eleanor Kramer and I'm the specialist mental health midwife, so very much focusing on the same area as Michelle here. And so today we're doing a video to help answer some of the common questions about mental health problems and emotional health in the perinatal period. So that's everything from pre-conceiving through the pregnancy, birth and the postnatal period. So we asked Rosie Maternity Voices, that network of service users, to ask us some questions from service users and families. So we've got a little list of questions. So Michelle, is it okay if I just ask you some questions? Or would you like to just talk about mental health a little bit to start us off?
Well, obviously the reason we're talking about it today is because we know it's so common. It affects about a fifth of pregnant women in their pregnancy and beyond. And so we know that a lot of women will be struggling out there. So to put it into perspective, here at Addenbrooke's, we have about 5,000 babies born every year. And that means that's about 1,000 pregnant women who are struggling with their mental health during pregnancy. So it's really important to talk about it and know where you can go to get support.
Brilliant, yeah, thank you. So what support is there available for mums who are struggling during pregnancy, if they're finding pregnancy is taking a toll on their mental health?
Yeah, so there's quite a few places where you can go for support. Obviously you have your community midwife, so please talk to them if you're struggling. And you have your GP, who is fantastic at giving support and advice around anxiety and depression in pregnancy. But there's also lots of other places as well. So there's lots of charities like Mind, and Panda, who will support women who are struggling. And of course, here at the hospital, I run a wellbeing clinic within maternity to support those who have got quite severe mental health concerns, maybe something like bipolar or schizophrenia or an eating disorder or depression that just isn't easily controlled with simple therapy or medication. So if you are struggling with your mental health, please talk to your community midwife. That's what they're there for. If they feel that you need a bit more support, then they will refer you to our wellbeing clinic, where you may have a discussion with Eleanor or our other specialist midwife, Julie, or myself about your mental health and how we can best support you throughout the pregnancy and beyond. Now, some women would benefit from having some therapy, and so it may be that once you've spoken to us, we refer you to the psychological wellbeing service, where they would offer CBT or counselling to help you throughout your pregnancy. It may be we refer you to the perinatal mental health team. Perinatal mental health team is a team with a psychiatrist, nursery nurses and specialist nurses who just look after women who are struggling with their mental health in pregnancy, and they would be able to again give you general support, therapy and medication depending on how much you need.
Brilliant, thank you. So that perinatal mental health team, should those details be sort of available to all women or just some women, or how do women go about accessing that support or working out if they need access to that specialist support?
Absolutely. So most women won't need access to that support because for most women who are struggling with mild anxiety and depression, they will get fantastic support from their GP and the community midwife and from psychological wellbeing service. They won't necessarily need to see myself or Eleanor in the perinatal mental health clinics or the perinatal mental health team with a psychiatrist. But if you are struggling, the main thing is to talk to your midwife. Your midwife will talk to us, and we will see whether we think you would benefit from seeing us as an addition to your GP. So we don't give out our details to everyone because most people won't need it, but if you go through your community midwife, they will refer you to us if they think that you would benefit from an appointment with us as well.
Absolutely. And so then we've got a question saying, I know I've heard of baby blues, and a certain degree of struggling is kind of normal and to be expected after I've had a baby. But how can I tell the difference if this is normal, if this is baby blues, or if this is depression or something else?
Absolutely. So that's a really good question because it can be really hard to tell the difference between baby blues and depression. But we know baby blues only lasts for a couple of days. It's quite short-lived and it's quite mild. So yes, you can be very emotional, very tearful in the days after giving birth. But things settle and recover really quickly within a couple of days, and it doesn't stop you functioning or stop you looking after baby. Whereas postnatal depression goes on for much longer. So if you're still feeling low and emotional a couple of weeks after you've given birth, that's not normal. That's postnatal depression, and you need to tell someone and ask for help. And who you might tell, that might be your community midwife, it might be your health visitor, or your GP, all of whom are fantastic at supporting women with postnatal depression. Your GP will then have that conversation with you about what support you need, and it might be a referral to a psychological wellbeing service or the perinatal mental health team for support and therapy. It might be starting antidepressants, and again, antidepressants are safe in breastfeeding, absolutely fine to take them whilst you're breastfeeding. And they'll be able to offer support for as long as you need it in the postnatal period. Postnatal depression can also happen at any time after you've given birth within the first year. So often it happens quite quickly after you've given birth within the first few weeks, but sometimes it can be 6 months later before it really hits. So again, don't be frightened of going and having those conversations with your GP about how you're feeling and how they might be able to help you, because there is support available out there, and the perinatal mental health team would be able to offer support at least a year after you've given birth, and the psychological wellbeing service can offer support at any time as well.
Fabulous. And so you said it sometimes can come on much later.
Yeah.
So how long after the birth could I seek mental health support?
So obviously there's no time limit on mental health. Anyone can go to their GP or contact psychological wellbeing service if they're concerned about any mental health problem at any stage in life. But in terms of postnatal depression and support from the perinatal mental health team, then you would go through your GP, and if the GP was concerned that you needed some extra support from them, then they would usually refer within a year of you giving birth. Although there is talks about that might be extended to 2 years after birth. So that's how you would access help from them. But in terms of psychological wellbeing support, your GP, there's no limit there.
Brilliant. So if people are worried about their own mental health, or if birth partners, family members are worried about the gestational parent's mental health, what kind of signs and symptoms should they be looking out for to help them to decide whether or not they need to seek some extra support?
So I think the main thing is just to have that conversation with your community midwife. If you're not sure, just talk to someone. That's what we're here for.
Right.
Things to look out for is if you're feeling low every day for a fortnight, then that's not normal. Everyone has bad days here and there. But if it's persistent and you're feeling really rotten and rubbish for weeks, then I would say talk to someone, ask for some help. If your anxiety is so bad that you're not sleeping, you're not eating, you're not enjoying your pregnancy, then please do talk to us. And if you're a birth partner or family member and you're looking after a pregnant woman and you can see that they're not themselves and that they're struggling, then don't be frightened to have that conversation with them and with the midwife, because when you're feeling that low, sometimes you don't realise how sick you are. It's the people around you who notice that you're struggling and not yourself. And so it's great to be able to support birth partners by having that conversation with the midwives so that they can access that support.
Brilliant, thanks. Yeah, we're never going to judge anyone for asking those questions, and everyone deserves to have a happy, healthy pregnancy, don't they? So, so it's never too early or too late to be asking those questions and exploring things with your team and with your family and friends. Absolutely brilliant, thanks. So if I'm thinking, this isn't just baby blues, if it's lasting longer or if it's coming on later, then what support is available through those? If I try to access support through what you've said, what can be done for me?
Yeah, so as I say, the main thing is to go and talk to your GP, and then the GP will have that conversation with you about medication and therapy. And if you decide that you want therapy, they'll then refer you to the psychological wellbeing service or the perinatal mental health team for supported therapy with you and your baby. And the GP will be managing and looking after antidepressants if you need those.
So then our next question was for women who maybe have already been taking medications or are considering medications in pregnancy, can I take antidepressants or any other sort of psychological medications while I'm pregnant or breastfeeding?
Absolutely. So for the majority of women, most antidepressants are considered fairly safe in pregnancy, and that the advantages of taking them far outweigh the disadvantages. So we would be advising people to continue their medication, particularly common medications, common antidepressants such as sertraline or Prozac or citalopram. We use a lot in pregnancy quite safely. There are other medications as well which are a bit more complicated. So mood stabilizers like lamotrigine, quetiapine, lithium are often used as well, and none of those should be stopped in pregnancy. The main thing is have that conversation with your psychiatrist, with your midwife, with your GP, and if they're not sure, I'm always happy to be contacted to have those conversations with people, because we know that if you stop your medication, the chances of you relapsing and becoming quite unwell can be quite high, and I'd much rather you are well on medication than unwell off of it. But definitely have those conversations. Don't just stop your medication. And of course, if you're thinking of getting pregnant, have that conversation before you get pregnant so that you're not worried about it, and that we know, if you are on a medication that's not quite right, we can change it. Although there are very few medications that I worry about in pregnancy. Most of them are okay.
Great. And then at the other end of the scale, if, for example, there's a woman who maybe she's had some pre-existing mental health problems, and she's worried about what will happen if she gets pregnant or her care, can people seek, preconception advice and support?
Yeah, absolutely. So again, go and have a chat with your GP and say, I'm thinking about getting pregnant. I want to talk to somebody about my mental health medications, or how can I be as well as I possibly can be going into a pregnancy. And your GP may well be able to answer all your questions, but if they've got any concerns at all, then they can refer you to either the perinatal mental health team within psychiatry, or they can refer you to me in the wellbeing clinic. I'd be more than happy to have a chat with you about your medications and how we can best support you going into a pregnancy. So yes, it's really important that going into a pregnancy you're as well as you possibly can be, and that includes mental health as well as physical health. And obviously it's a great opportunity to review your medications and make sure you're on the right things for you.
Great. And would that also apply to, for example, women who are struggling to conceive, because sometimes that can cause mental health problems? Would they be able to access the same support?
Yeah, absolutely. So again, we always want you to be as well as you can be before you conceive, whether that's spontaneously or through IVF. So of course, have that conversation with your GP, and if your GP wants specialist advice, then they would refer you to the perinatal mental health team or myself.
Great. Then our next question was, if you have a traumatic birth, what advice or support are you given after that, both in the hospital, if it's in hospital, and then after you go home as well?
Sure. So if you've had a birth that you found traumatic, then again, it's talking to people about it. So when you're in the hospital, ask to go through the birth either with your midwife or with one of the doctors, so they can answer any questions that you've got at the time. But we find that a lot of people struggle to process things immediately after birth, and that they need some time to go home and process things and then come back at a later date. And so you can request an appointment with our birth afterthoughts midwife or one of the consultants who is looking after you in your labour, and they will go through the birth with you and step by step answer any questions you've got, and also help you make a plan for your next pregnancy to try and make that less traumatic and avoid the things that were distressing this time round. So absolutely ask for help and ask for that discussion to take place if you're struggling with what's happened.
Great. So then our next question is, for women and families whose baby very sadly dies either before, during or shortly after birth, or who experience other forms of pregnancy losses and bereavement, what support is available to those people?
Yeah, so obviously if that happens, that's a horrendous thing to go through, and there is support available. So within the Rosie, you would be contacted by our bereavement midwives who would offer specialist care for you, and they would put you in touch with extra support in terms of charities such as SANS or Petals, who offer a lot of support for families in that situation, as well as support from the Rosie itself.
And then also we know that sometimes mental health problems, emotional health difficulties can affect the wider family as well, and especially, you know, other parents, you know, non-gestational parents and birth partners and other family members. Is there anything available for them?
Yeah, absolutely. So again, I've said it a lot, but if you go see your GP, it goes to, you can self-refer to psychological wellbeing service as a partner as well. So it's really important that partners and family members who are supporting the woman giving birth are also as well as they can be in terms of the mental health, because obviously as a family unit you're working together to raise the child. So I would encourage you to go and get support if you're struggling as well. And the perinatal mental health team again looking into what support they can offer for dads mostly, or for birth partners. So have that conversation again through your GP, and they will refer as needed.
Great. And then lastly, so we know that with a variety of mental health problems or with other sort of difficult life experiences, sometimes just talking to other people in the same position, or, you know, networking with people who've sort of come through the other side of those difficulties can be really helpful. So are there any sort of groups or sort of peer support programs, things like that, for mums to talk to other mums?
Yeah, so I would encourage you to get in touch with the Rosie Maternity Voices. So that's a group of people who have used the services in the Rosie and are wanting to feedback and help us improve the services. So they will be able to help you with that network. The perinatal mental health team also have a group for women who have gone through their services and have lived experience to help support each other. And other groups such as Mind and Panda may also have similar groups. So yes, there are opportunities to network and to feedback your experiences.
Brilliant. I think that's all the questions we've got today. Is there anything you'd like to say in summing up? Any last?
No, absolutely. I mean, the main thing is don't be frightened to ask for help. Okay, there's the stigma that used to be out there is pretty much gone. We know looking after your mental health is every bit as important as your physical health. So don't be frightened to ask the question, don't be frightened to ask for help, because there is lots of support out there if you need it.
Absolutely. Thank you so much. Thank you.